Everyone needs glucose, or sugar. It's an important source of energy that all the trillions of cells in our bodies need. It gives our cells energy to do their daily work, and it helps our brains function. After we eat, glucose circles around and around in our bloodstream. Our cells gobble up this glucose, which helps keep the sugar in our bloodstream balanced. In diabetes, glucose does not properly get into the cells. Instead, the sugar circles around and around and around and around, staying in the bloodstream. If diabetes is not managed and high levels of glucose remain in the bloodstream, serious health consequences can result. It is important for anyone with diabetes to know that 1. You're not alone. 1.4 million new cases of diabetes are diagnosed each year in the United States. Over 29 million Americans have diabetes, and of those people, over 25% of them are 65 years or older. 2. As already mentioned, there are serious health complications that can happen if you don't manage your diabetes, including heart and blood vessel disease, neurological conditions like blindness and loss of sensation, kidney failure, and the list goes on and on. We will talk more about these here in a minute. The most important thing to know about diabetes is that there are steps that you can take to help decrease your risk of developing these health complications of diabetes. So, what are these serious health complications? If unmanaged, diabetes can cause a host of problems for your heart, your nervous system, and your kidneys. Uncontrolled diabetes dramatically increases your risk for cardiovascular disease, including narrowing of the arteries and high blood pressure, heart attack, and stroke. Uncontrolled diabetes can also cause nerve damage, also known as neuropathy, especially in the legs and feet. If left untreated, this can result in numbness, tingling, burning, and eventually a complete loss of sensation in the affected limbs. What is worse is that poorly controlled diabetes can cause improper healing of infections and wounds. This means that if you were to get a blister or a cut on your foot, you may not notice it until it's dangerously infected. This infection may spread and could possibly result in amputation. Uncontrolled diabetes also damages the kidneys, the organs that help rid your body of waste and toxins. This can result in kidney failure or irreversible end-stage kidney disease, requiring kidney dialysis or transplant for survival. The list goes on and on for the damage that diabetes can do if uncontrolled. Fortunately, there are actions that you can take to help minimize this damage and to live a long and healthy life. The most important thing that you can do if you have diabetes is to make sure that you have control over your blood glucose levels. You can do this through proper diet, exercise, and medications prescribed by your doctor. The American Diabetes Association, or ADA, recommends a balanced diet full of nutritious foods. Some of the top 10 diabetes superfoods that should be worked into your diet include beans, like black beans, kidney beans, dark green leafy vegetables like kale and spinach, sweet potatoes, berries, tomatoes, fish that is high in omega-3 fatty acids like salmon and tuna, whole grains like barley, oats, and whole wheat breads, and fat-free milk and yogurt. The key to a healthy diet is moderation. Even too much of a healthy food can raise your blood glucose levels too high. It's important to talk to your doctor about your diet, and together you can develop a healthy eating plan that works best for you. The ADA also recommends 30 minutes of moderate to vigorous aerobic exercise at least 5 days a week. Moderate exercise means that you can talk, but not sing, while doing the activity, while vigorous exercise means that you cannot say more than a few words without pausing for a breath. You can walk, swim, dance, play tennis, whatever exercise is the most fun and enjoyable for you. Lastly, it is very important for people with diabetes to regularly check their blood glucose levels. The ADA recommends a target glucose level of 70 to 130 milligrams per deciliter before a meal, while glucose levels should be below 180 milligrams per deciliter 2 hours after a meal. If you find that your glucose levels are regularly higher or lower than these target ranges, it's very important that you speak with your doctor to come up with a game plan. By having control over your diabetes through diet, exercise, and medications, you can reduce the damage that diabetes can do to your body. So what about heart, nervous system, and kidneys, like we talked about before? Fortunately, all of the above healthy recommendations help reduce the risk of damage to your heart, nervous system, and kidneys. However, to help detect changes to these systems, the ADA recommends the following: regular checks with your doctor for high blood pressure, cholesterol, and triglyceride levels, regular screenings for kidney disease, annual foot exams to check for neuropathy and nervous system health. People with diabetes can live long, happy, and healthy lives. Take the time to check with your doctor and discuss positive changes that can be made to help reduce your risk of health complications from this disease. Please visit diabetes.org for many helpful hints and tips, and to connect with people just like you for help and support in controlling your diabetes.